All right, so we are recording. So kind of what I wanted to do today is just say hi to everyone so you knew who was going to be teaching your course this semester. I also wanted to kind of go through any questions that you have on the course, on clinical, and anything like that. So to start off, I'm Erin Sexton, even though my name says Macaulay. I got married. I don't know why it won't let me change it. So I'm Dr. Sexton, and I will be a couple of things for you all. One, I will be your professor for this psych course. I will also be some of your professors for evidence-based practice. I'm also the course facilitator for psych, and I'm your term lead. So if there's any questions you have or any issues in general, just kind of on the whole semester or any of your courses, let me know and I can try and figure all that out for you. I have been teaching at Madonna for about 6 years now. I started off just teaching psych and med-surg clinical, but over time have started teaching pretty much any lecture that we have except for peds and OB and clinicals as well. So I've done community health clinical, fundamentals lab, med-surg 1 lab, med-surg 1 and 2 lecture, leadership, evidence-based practice, nursing fundamentals, obviously psych. So if you have any questions, even if it's outside of psych, feel free to ask me at any point. And I'd be happy to talk through any concept with you all. But psych I particularly love, and I'm really excited to be able to teach this course. I think it is a special course that kind of gets a bad rap in the sense that as much as there's stigma against patients with mental illness, there's also a lot of stigma against psych nursing in general. As far as funding goes, psych units do not get great funding. So a lot of the care that is provided is outdated. When you all have clinical and go on the units, you'll see how outdated the units are and how disgusting some of the units are. So it's really sad to me to have to see that, but it's also a great opportunity to really practice both the art and the science of nursing, and to be able to go into these environments where people are stigmatized and maybe told that they're lesser, and be able to say you're not lesser, you are important, and we're here to help you. So I really hope you all enjoy the course. I think that it is a little bit more interesting than some concepts in med-surg and whatnot, but I may be biased against that. And I just think it's also a really important topic because what you'll learn in this course, you can apply in any field of nursing, and you will have to apply it no matter what setting you go into. So kind of the main focuses of what we're going to be learning in this course is things like how to effectively communicate with patients, how to be creative in applying the nursing process, how to recognize not only the core psychiatric diagnoses, but also how your mind works with your body and how your mind and your emotions can be affected by everything, whether it be actual physical symptoms of mental illness or whether it be social interactions like grief or natural disasters, things like that. So this course, I think, does a decent job at tying all the pieces of nursing together. Also, no matter where you work as a nurse, you will have patients with a mental illness. So you'll have to know how to apply these skills no matter where you go, even though this is considered a specialty course. So that's kind of my little intro into psych nursing. And yeah, any questions so far? You can either type it into the chat or say it if you have any at any point. So. All right. So this course does run over the 14 weeks of summer. There's 16 modules in the course, so there will be 2 weeks where you'll complete 2 modules. I picked the 2 lightest weeks for that to happen, so hopefully it won't be too much doing 2 modules in 1 week, but I'll let you all know what I like to do, and I apologize for anyone that's in the section that I don't have access to yet, but every Monday I will post an announcement just kind of reiterating like, hey, this is what's going to be due this week. This is what I want you all to focus on. And I do think that it's really important that you read those announcements, because sometimes I'll give an extension on an assignment that isn't reflected in the grade book, but if you read the announcement, you'll know that it won't be marked late. Or there may be a discussion board where I'll put in the announcement that you don't need to do a response to your peers, or I may give tips on how to approach certain assignments or what is going to be most important to remember on the exam. So it is going to be really important for you all to read those announcements and let me know if you have any questions on those. So with that, kind of talking about assignments, I feel like I'm jumping all over the place right now, but with the assignments, there are due dates. For every day that the assignment is late, it is a 5% deduction. After a week of not being turned in, the assignment will not be accepted. That being said, I know lives get busy. I know things happen. I know that there's, family situations and whatnot that come up during certain times. And I do want to work with you all. Being a mental health nurse, I think it's so important that you treat your mental wellness as much as your physical wellness, and find a good balance between studying and taking care of yourself. So if there is a week where you just have a lot going on, or something, an emergency happens or something, send me an email. Let me know that you may have difficulty getting the assignment in, and I'll work with you to make sure that you don't get those deductions that you would if you don't communicate with me. Obviously, if there's a student that emails me every single week and says, hey, I'm not going to get this assignment in, then we'll have to talk about that. But, I'm more than happy to work with everyone as far as getting their work done and making sure that you're able to put in a good effort with it. So any questions on that? All right. So this course, like I said, does have the lecture component. It also has a clinical component. So your clinical will be 7 weeks long. Those of you that started clinical today will know this already, but we do start off with a boot camp for the first day of clinical at Southfield campus. So if you were there today, you obviously got the email about it. If you are in a clinical starting this week, Wednesday, I did send out an email to you all as well. If you did not get it, let me know. For those of you that are assigned to the second 7-week rotation for clinical, you'll get your email closer to when that starts. I'm trying to think anything else with clinical. We pretty much cover all the clinical information in boot camp, so I won't get too into that. But any questions on clinical or any concerns about clinical placement or anything? All right. Then the next thing that I want to talk about, you guys are all pretty familiar with Canvas by now, right? So you don't need me to go through how to find your assignments and whatnot. So the syllabus is posted. Feel free to take a look at that. It's pretty standard as far as your other classes go. Same ATI policies, same grading rubric and everything. We will have 3 exams in this course. 2 of them, well, each exam will build off of each other. So the first exam obviously will be completely new questions and new topics. The second exam will be like 2/3 new topics and new questions, and 1/3 repeat questions or repeat topics. And then your final exam will be 3/4 repeat topics and then 25% new topics. So before each exam, there is a discussion board that you don't have to, sorry, my cat is just going crazy right now and is all over the place. But before each exam, there is a discussion board where you can post any, stop it, where you can post any questions about any of the material. He's like headbutting me right now. Hold on 1 second. Gosh. Okay. So if I know he only gives me attention when I'm on Zoom. But so before each exam, if there's enough questions in the discussion board where people don't seem to be getting a certain concept or something, I will have a large meeting to answer questions for everyone. If not, I'll just answer the questions in the discussion board. But if anyone needs to meet to review any concepts or assignments at any point, send me an email. I'm more than happy to Zoom one-on-one to help answer any questions or anything. So any questions on exams? Like I said, we will have ATI in this course as well. So you'll have your ATI proctored and practice exams.
I don't have any questions on the exam, just on to go back to the clinicals, I guess. I just reread your email. So we had boot camp today for MedSurg 2. So do we have a different boot camp for mental health?
Yep.
Okay, thank you.
Yeah, no problem. So a question in the chat is, will we be having weekly Zoom meetings? We will not, unless if there's like a big group of you that's like, hey, we're not getting this concept, feel free to email me. I'm more than happy to Zoom with people, but this course, I think, is a little bit slower paced than some of your other courses. So students typically don't need to meet every week. So I stopped having weekly meetings when only 2 people would show up. So if people need to meet, I'm more than happy to meet, but we will not have like a scheduled weekly meeting. That being said, there are lectures that will be posted each week. And I do have all the lectures posted in my YouTube channel. So if you just Google or put into the YouTube search Erin McCauley Nursing, you'll find all my psych lectures and all my lectures for evidence-based practice. So if you're ever in Canvas and you're like, oh, I can't find this or the link's broken, just go to YouTube and the lectures will be on there. So we covered lectures, we covered exams, we talked about assignments. There are a few discussion boards this semester. As with your other courses, you have your initial response and then your response to peers. Both your initial response and your response to peers should have scholarly sources to back up what you're saying. It should be an APA format with both in-text citations and references. I think overall that's what students get marked down on the most in this course as far as discussion boards go, for not having APA properly cited or not having any references or anything like that. So make sure that you pay attention to that when you're doing your discussion boards. You will have one paper kind of towards the middle of the semester. I hope it's a funner paper. You'll be taking a cartoon character or a celebrity that has come out and said that they have a personality disorder, and you'll be writing a paper on what that celebrity or fictional character does that shows the symptoms of that personality disorder. That is the only assignment that we'll utilize Turnitin for. So as that gets closer, I'll make sure to post an announcement. So a question, should we have references even with our reply post our peers? Yes. Your response to your peers should be thoughtful, offering supportive information or more information, and it should have references. And then outside of just basic assignments, discussion boards, that paper, you will have a couple of presentations, one of them being this week. So I think it's due. Let me pull it up really quick and see when it's due. Since the one course didn't get the information about it, I will extend the due date on that. So let's see. Sorry, give me 1 second. So it's due on Sunday. I'll extend that presentation upload to actually be due on Tuesday. Some of your groups did change, and because I don't have access to the other group, it may still change. And the reason for that is when I opened it up, some groups only had 1 person in it, and it's pointless to do a group project by yourself. So for the people in the one section that can see my announcement, your groups are set. For the people in the groups that can't see my announcement, your groups will likely change hopefully tomorrow or tonight if I can get access to the course. So you should have, some groups I think have 2 to 4 people in your group. So let's see, there's another question. So the next question is how to see if you're for or against, or if you're assigned to being for or against. So if you go to the actual assignment in the Canvas module, and I'll kind of pull up what it looks like. Whatever group you are corresponds to it. So if you're assigned for group 1, you're for the use of restraints. If you're assigned to group 2, you're arguing for against the use of restraints. Group 3 is for court order for treatment. Group 4 is against court order for treatment. So that's kind of where you can find what topic you're supporting or arguing for. All right, so any other questions on this week's assignment? The other assignment that you have is the mental health petition form. So that assignment, you're basically just filling out. Typically that petition form, or I think it's actually the clinical certificate that you're filling out, that will usually be done by a psychiatrist, but it's just good practice to fill it out so that you know what information's typically in it. There may be some information on the form that is not given in the scenario. So you can either make up that information or put unable to obtain. And I believe that is your 2 assignments for this week. Yes. Oh, yeah. So it's just those 2 assignments. So any questions on your assignments for this week? All right, cool.
I have another question.
Yeah.
For the ethical dilemma one, is there a video format that's best, like PowerPoint with voiceover, or like presenting on like a board?
You can do it however you prefer. I have always found, I think that PowerPoint voiceovers are hard to do. I've never really quite figured out how to get them saved properly. So if someone in your group knows how to do it, great, go ahead and do that. What I usually find the easiest, but it kind of depends on people's comfort level, but just recording a Zoom session and posting that link. But yeah, whatever avenue your group is comfortable with recording it, I'm totally fine with. All right, any other questions? All right.
So for the ethical dilemma, that is group
Mhm.
work. Okay.
Yep. Yeah, so if you're in the section where you're the only one in the group, hang tight, that will change.
Okay, yeah, I just got a little confused because I kept seeing just myself in my group.
Yeah, so don't worry, take a look at it tomorrow and hopefully it should be updated.
Okay, thank you.
Yeah, no problem. All right, I'm just looking through the course to see if there's anything else I need to talk about. We will be doing ATI dynamic quizzes this semester as well. I know that you get those in MedSurg prior to doing it here, but if you have any questions on how to get those set up or what those are, or how to do it, let me know. We don't actually do it until next week. So I'll post an announcement about that. And if you have any questions, let me know. Does anyone have any difficulty accessing ATI? Also, if you were in another cohort at some point, send me an email because you'll be in a different cohort for ATI. And I just want to make sure that I am able to know that so that when we go in and put grades through ATI, I can make sure that I don't give you a 0 because I don't see you in the class list for this cohort. And then let's see. I think that's kind of the basics of this course. Trying to see if there's anything else I wanted to talk about. Oh, professionalism. So you do get 5% of your overall grade is based on professionalism. Those points can be removed either from poor clinical behavior, late assignments, misconduct in the lecture setting or whatever, but just know you guys have been taught what nursing professionalism, just practice professionally, and I'm sure you'll have no problem getting the points. But yeah, that's about all I have to talk about. So any questions, concerns, comments, thoughts, any other information you think you need to get the course started? All right, well, it was nice meeting you all. To those of you that are in the course that didn't get the announcement, I am so sorry. I promise I'll figure that out soon. And we'll kind of go from there.